All right, so we're going to go back to Access Health CT. Christopher, take it away, and you got the rest of the show.
Great. One of the questions that you left here for me, Michael, I'm going to get into where you can find and get help in the community, but one of the questions you asked me was about preventive care benefits. Under the ACA, all the plans being sold, whether on exchange or off exchange, must provide for preventive care benefits covered at 100% cost share. Some of those benefits that we've outlined are blood pressure screenings, cholesterol screenings, colorectal cancer screenings, so colonoscopies, depression screenings.
And please remember, March is official colon cancer month.
That's right, it is.
Yes, it is, sir.
So these are, this is a great part of the law, because what it does is, it entices people to use their coverage knowing that it's 100% cost share, and they don't have to pay anything when they go to the doctor's office when it is a true preventive care claim. So it really motivates people to get out there, go see their doctor, be proactive, make their yearly checkups, get their colonoscopies, get mammograms, get the things you're supposed to get at the ages you're supposed to get them. So it's important for people to understand that any plan you buy, whether it's on the exchange or off the exchange, in the individual market, the small business market, or the large business market, is going to have these preventive care benefits at 100%. The next question, one of the things Mike left for me here that the viewers wanted to know was, where can I get care in the community? Where can I get low-cost care in the community? And fortunately for the consumers, as of right now, the Stay Well Community Health Center in Waterbury, 80 Phoenix Avenue in Waterbury, Connecticut, is a place where you can receive great care in the community, local to Waterbury. And actually, right now, we're actually running a health fair. We're running a enrollment fair at the Community Health Center on 80 Phoenix Avenue in Waterbury right now. You can go down there. There's insurance brokers there. There are certified application counselors from Access Health. There are people to help you get on the website, get enrolled, fix your problems. If you have to get enrolled in Medicaid, you can also go down there. Or if you have coverage and you want to ask some questions and understand how your coverage works or how the network works or how your benefits work, you can head down there. Me and Mike are actually heading down there after the show.
If you saw in the Republican American, the Stay Well Health Center will be taking over the St. Mary's Pediatric wing, which is a big plug for them. Hopefully that'll boost the community. They have worked tirelessly. One with my friend Katie Melko, a friend of producer Nick's, family member or friend? His cousin, who has a great organization called Miles for Smiles, and I am proud to say I run in their 5K, and I always plug them. They work with getting inner city children who have no dental coverage whatsoever. They work with the Stay Well Center to fund certain cleanings and visits. With the Affordable Care Act, obviously Jason Madrick clearly put it in. It's included in your Husky, which is CHIP. Chris will go over that. It's included in your regular purchased plans through Access Health. But let's say someone unfortunately misses the deadline.
Okay.
What other options will they have?
So, good question, Mike.
Good question is right.
With regard to the deadline, March 31st at midnight is the last time to enroll. After March 31st, actually very similar to Medicare, which Mike talks about, we have what we call special enrollment periods, SEPs. You have these in Medicare, well, we're going to have them in the individual market. To qualify for a special enrollment period, you need to have what we call a qualifying event. So some of the possible reasons that somebody could have a qualifying event is, the number one reason is loss of MEC. MEC stands for minimum essential coverage. So any type of loss of coverage, whether it's a small business plan, they're your employer, or individual coverage, your plan's renewing, and you decide, and the insurance company is no longer offering it. If you lose your coverage and you want to go on the website, you can go on the website, and there's a place in the application where you can denote that you have an SEP, you had a loss of coverage. It could be your COBRA extensions is expiring. A small business could be going out of business, and they're no longer offering coverage because they're out of business now. And you go on the website, and there's an SEP section on the application. You put your information in, and the way it works is, once you qualify for SEP, you have a 60-day enrollment window in which you're able to enroll. On the website, it's going to be a self-attestation. You're going to let them know that you are losing coverage, and you're going to have to upload a documentation saying you lost coverage because your COBRA expired, your employer went out of business, your plan's not renewing this year, and you have what we call a 90-day verification window. So as I said, for SEP guidelines, if you do have a special enrollment period, you have a 90-day verification window to upload your documentation to the website. There's a tab where it has an upload button. It's an orange button, and you can scan in your documentation. The best thing to scan in if you're losing minimum essential coverage, which is the primary reason for a special enrollment period, is to scan in the certification letter from your former insurance carrier and letting them know that you lost your coverage. So a lot of people are nervous about the timetables. If you lose your coverage, and it's after the 15th of the month, because a lot of people are focused on the 15th of the month because that's what we've been saying for years, for this year. You have 90 days to upload the documentation or mail back the documentation when we send a letter out to you with a number on it. So if it's May 1st or May 15th and you haven't gone on the website yet, you take 5 days, you go on the website, you finally enroll, you can get coverage for June 1st or July 1st. And then from the date you actually went on to apply, so if you went on the website to apply on May 20th, you have 90 days from May 20th to upload your certification letter from the insurance carrier to prove that you truly lost coverage and you were eligible for that special enrollment period.
That's so true. And what the certification Christopher was talking about is the HIPAA certificate, Health Insurance Portability and Accountability Act coverage letter. The HIPAA certificate coverage letter, you can simply just call up your carrier, 1-800, whatever it is, and they can send it out. It does usually take a week or two. All right, Chris, take it away and let people know how to access the website. And if you don't go to the website, we'll see you at 80 Phoenix Avenue today.
Yeah, so the website, again, is www.accesshealthct.com. That's www.accesshealthct.com. The best thing to do from the website, you can go to the Get Help tab, and you can check off the Broker tab, and you can search for a broker in your area by location, by town, and you can find a certified licensed insurance broker to help you with the process.
Now, another thing people don't realize, will the navigators and the assisters, will those be reduced dramatically after the 31st deadline?
Yeah, those will the primary resource for enrollments and for Access Health CT operations will be the brokers.
And the website itself.
Correct.
Okay, so again, thank you very much for listening. We've got 30 seconds left. It's been a great show. We'll go back to traditional Medicare and you for the rest of the year, but the deadline's the 31st. It is not going to be extended like the federal government. Get out there, get yourself some health coverage, or you're going to get a fine. Talk to you soon, and thanks very much for all you listeners out there. Bye-bye.